Hi, my name is Mia, and I'd like to do a little video of my DRG Stimulator Trial, just for my own purposes and for anyone else that may be kind of intrigued about DRG stimulators, and anyone else that is suffering from any type of chronic nerve disease, nerve pain, and have discussed this with their pain management doctors and their neurologists. This may be something that you may look into and may want for your treatment plan. So I have CRPS type 1 and type 2 in my left leg, stemming from the knee, and it has now migrated down my leg, down my shin, into my ankle and my foot. From a mountain biking crash in September of 2021. So it's been a long haul, which is not unusual. Most CRPS patients the average is about 2 years, sadly, to be properly diagnosed. I decided to take myself to Cleveland Clinic to get my diagnosis. I tried to do pain management and other therapies here in my specific state and my specific area, and was not getting, I could not get a diagnosis after seeing, multiple rounds of PT, seeing my PCP, seeing a rheumatologist, having multiple full blood panels done with a rheumatologist, and nobody could figure out what's going on. I had 5 months of back-to-back Lyme's testing. So it is not Lyme's, even though some medical professionals here were convinced that it was lupus, Lyme's, or MS. All my screenings, and I had multiple waste of time, money, and energy to prove yet again that there was nothing wrong with me via an autoimmune disease or autoimmune issue. So after I'm not going to tell you how many, but after multiple full rheumatoid panels and nobody here could figure out what was wrong with me, I decided to take myself to Cleveland Clinic. And I need to preface and backtrack and say that in June of last summer, June 14th, I actually had knee surgery, laparoscopic knee surgery by a well-known orthopedic surgeon here in the area. Knee surgery was successful. It is not his fault or his medical staff fault that I developed CRPS. It is just a risk that you run with any surgery you have. I don't care if you have a C-section, you could have nerve disease, nerve damage after any type of major surgery. So just putting that out. I'm not pointing fingers at anybody. Cleveland Clinic got my proper diagnosis the first visit within 2 hours of meeting my orthopedic surgeon, my neurologist, and my pain specialist there. Diagnosed with CRPS, which totally made sense. I mean, I had every single, symptom on the Budapest criteria. So the Budapest criteria is what they use to diagnose a CRPS. And I had all of them. The discoloration of my limb. So my knee was turning purple and blue. It was swollen. It was like super sensitive. So they call it allodynia. It felt like my leg was on fire and being crushed all at the same time. So think about like when you see cars being crushed in the junkyard. That's what my leg felt like that. And as if somebody poured gasoline on my leg and threw a match on me. That's what my leg felt like all the time. And then walking, add that burning, that constant fire and the crushing of your leg to where you literally think your bones are being crushed. Add being electrocuted every single time you walk. So yeah, I went months and months and months hobbling around with a cane because some days I would wake up and my leg would say, "Not today, Satan. You want to walk? No fucking way. We're not doing it." So the only way that I could stay mobile and go to work and be mom and do all the things in life that you need to do, I had to use a cane, and I still use a cane to this day. Use your mobility aids. They are not a hindrance. They actually help you. And if you need them to feel more stable and secure so you don't fall, because until I got my canes, I would just go out in public and try to go get gas and groceries, and I would end up falling in public. And that was even worse than using the damn cane. So yesterday I started my DRG trial. I had surgery. Everything went well. Everything went swimmingly. Today is day 2. It's about halfway through the day. My back pain is a lot less. I woke up and I'm able to like roll myself over onto my side and then to my back to ice it without needing Pete to roll me over anymore. Last night was pretty miserable. Every 35 minutes to 45 minutes, he was having to come in and help roll me over and ice my back, etc., etc. Today it's much, much better. I also started my stimulators, S1 and L4. S1 yesterday when I left the hospital was set to 13, and my L4 was set to, I believe, a 13 or a 14. I actually turned them down halfway through the night just because I was laying there, and like everyone knows that has CRPS, your affected area is always worse at night. I don't know why. It must be the way that your brain kind of goes to sleep. There's something neurologically that happens that makes your CRPS like fucking awful, like 2,000 times awful at night. So I woke up, realized that I could feel my stim, and turned both of them down to a 4 last night, and was able to sleep fairly well in between the stints of having to be rolled over and getting up to go to the bathroom, which was also a nightmare and totally gave me anxiety every single time I had to get up and ask Pete to help me stand up to walk down the hall and use the bathroom. So yeah, that sucked. However, today, much better. I actually walked myself down the stairs this morning, pain-free. My leg does not hurt at all. I do not feel my stim at all. Walked myself down for breakfast, made myself an instant oatmeal, and came back upstairs. Again, walking upstairs, left leg, no pain, 0 pain whatsoever. However, bad thing is now my right leg, my right knee that has arthritis in it, feels like crap. It's making me hyper aware that my right leg, that I have been favoring for 2 years now, is hurting. So when I see my pain doctor next week on Wednesday for my explant, I will have him put an injection in my right knee because it is cranky and pissed off. I hope that today I can stop taking so much Tylenol, because right now I'm pretty much taking Tylenol every 4 hours, 2 pills every 4 hours. I decline pain meds just because I don't like narcotics. Narcotics and opiates are just not something that I'm willing to do. So thus far, prior to this DRG stimulator, I have only been taking gabapentin, memantine, and a muscle relaxer, methocarbamol. I can't pronounce it. It's some big long name. At any rate, those are the only ones that I've been taking because I won't take any type of narcotic or opiate. So yeah, it's going okay. Day 2. Somewhat okay. My back pain is lessening, which is good. They said that it would go away. Tomorrow will be day 3, which is when they said that you will notice. Day 3 and day 4 are the other true days where you really like, oh, okay, this is definitely making a significant change in my pain, in my CRPS. So right now I'd say that just because I'm still got some anesthesia lingering in my body and my back is so painful, I really can't focus on my leg, but I mean, like, it's noticeable that the pain is gone. I'd say maybe 25 to 30% less pain than prior to my DRG, and I'm also not noticing any pain when I'm walking and going up and down stairs, and stairs have been my nemesis for the past 2 years. Since 2021, since my accident, I have not been able to walk up and down stairs without wanting to throw up. So that's a win. I will update you guys later tonight, but I thought I'd do a recap of surgery day and halfway through today. And if you're interested, stay tuned for the next update, and I'll talk to you then. Bye.